All right. Okay, here we are again. It's Mouth Breathing May, and so I am interviewing MyoMentor students and graduates who are super exciting for me to meet. Every day in the month of May, I'm doing a new interview, and I have Diane here today, and I'm super excited for you to share your story, Diane. So, um, let me just talk about where you're from first. I know you're in California, Monterey Peninsula, right?
Yes,
And
yes,
your practice is called, I don't want to get it wrong, Breathe by the Bay.
yes,
And I know you're excited to share the story of your family because you've got 4 kids and 3 of them need myofunctional therapy in one way or another, right? And maybe
yes,
your husband too.
yes.
So you kind of got like a whole, family full of people that you can help. So tell us anything else about your background that I'm missing and
Okay.
yeah.
Well, I'm Diane Diniz, and yes, my business is Breathe by the Bay. I am currently living in Pebble Beach, California, and I've been practicing dental hygiene here for the last 20 years, and I've been a dental hygienist for 25 years now total. So in the field for a long time now. And
And
well,
you
my
just
story
opened
really
your practice.
begins. I did. I just opened it last year.
It's so exciting. I'm
Yes,
really glad that
it's
you're doing it. Yeah.
very exciting. It's baby steps. I am a mom of 4 and working full time, so it is baby steps getting there.
Totally. But yeah, I cut you off. So talk about how you first got started because I know you've got an interesting story.
Well, I didn't necessarily get started with Myo in 2009, but that's where our story sort of begins. And it was with my son, Derek. He's the third in line. And
How old
I
is
had
he
gone
now?
to, Derek is now 12, just turned
Okay.
12.
Yeah.
And so back in 2009, I went to a dental hygiene course, and up on the screen, they're showing facial growth patterns of children with tongue ties. And I just sat there and it just hit me. I just knew instantly Derek had a tongue tie. So
Oh man.
couldn't wait to get home. 2 hour drive home, it's just up north, just 2 hours from here. I'm on the way home, can't wait to go home and look in his mouth. And sure enough, he had a tongue tie that had gone undiagnosed. And his was pretty severe. He had a really anterior tie at this time. And
Okay.
once we
What would you
figured that
say,
out,
like a grade
gosh,
3?
all the pieces started coming together. I'm sorry, what was that?
Oh, I said, what would you say it was, like a grade 3 on that range of motion scale, or what's your guess for how restricted?
Yes,
Grade 3, grade 4?
probably grade 3, maybe even a grade 4. Yeah.
Oh, okay. That's
Um,
interesting.
he was he was just over a year, so it wasn't anything in his speech that we could hear at the time.
Hmm.
But once I did look in his mouth, things became so obvious. Every time he cried, he would put his hand in his mouth and he would stop breathing. So every
Oh,
time he would just get so upset, and it was so hard. We had to I would do anything I could do to calm him down because you could see it would get so tight in there, and he'd put his hand to his mouth and he would pretty much stop breathing every time he cried. Um, he was definitely a mouth breather because his blankets just were full of drool every morning. We'd wake up like, oh, these
oh.
blankets are so gross. But then
Oh
it
my
started to
God.
make sense,
Yeah.
he couldn't keep his mouth closed. And so he was drooling quite a bit, and even then I started noticing food as well. And I mean,
Like he struggled with
the,
eating it, or was he a picky eater, or?
he wasn't too picky. He did struggle. He did pretty well for being
Mhm.
as tight as he was, but just the little things, like when I looked back for him to eat ice cream, it was all over his face. So like he couldn't actually stick his tongue out to lick ice cream.
Oh,
So it was like the cone
yeah.
in his face, and he had the
Which
nice
is like,
ring around his mouth.
yeah, and it's cute when they're like little, but it's easy to not see that as like a dysfunctional thing, right?
Correct. Yes, exactly. Exactly. Um, so we had a release done. At that time, still wasn't as familiar with myofunctional therapy and the benefits of that. Of course, it probably might have been a little challenging because he was just a year old when we did this. But it made such a difference. And I continued watching him for a long time, and I just felt like I knew he needed something. So I got him into speech therapy. And that was hard because a lot of people said he was fine and he was normal for his age, normal patterns of speech. And I just knew, I just felt like, no, his tongue was tied for so long. He needed to strengthen some of those muscles.
Yeah.
So his speech therapist did help him a lot.
What you're talking about too, I think a lot of moms feel that way. Like they just know, even though they're told everything's fine, they feel like something's still not right, you know?
That's correct. Yeah. Intuition is really good to follow. Yeah. So, you know, years past, I'd still been getting some emails from AOMT regarding courses, and timing just wasn't right. And then in 2018, I had a patient come in our office, and she was telling me about her open bite due to her newest CPAP machine. And I thought, you know, let me help you. I think I can figure. I just was reading an email. I know that there's something out there for you. Let me get in contact. So I did a little research and connected her with AOMT, and she unfortunately couldn't do it at the time, but that kind of really started the ball moving. Like I thought, well, gosh, I was having to contact her with somebody in LA, and I thought, maybe now's the time for me to become a myofunctional therapist. So I really started doing research. I started listening to podcasts. I found you on a podcast, and I was like, oh man. And of course, I went and searched up your name and saw what you were doing and how you had a mentorship program. And I thought, oh, I'm signing up for this mentorship program as soon as I take my first 4-day intensive course. And I was lucky enough to meet you there. I felt like I was meeting a rock star. I was so excited. I was like, oh my gosh, I just listened to you on a podcast. I want to sign up and be a MyoMentor. And it has been a really exciting adventure because I think I've really found what I could do to serve others, and not even just serve others, serve 4 of my own family members, but how I can really help others with their myofunctional disorders.
Yeah, I love it. And you're so enthusiastic, which I think is what's needed in this field. I'm so enthusiastic too. I think sometimes I probably overwhelm people, like, whoa, you're too excited about this. So going to bring it full circle, what have you done with your family? And maybe talk about some of the other symptoms that you notice in your other kids and your husband, and just so if there's any patients listening, they can kind of understand what you started to see and notice that you want to help patients with.
Okay, so I'll go down the line here. So my husband is a classic case of the 6-foot tiger, 3-foot cage. So his tongue is very large. He did have an extraction, just one premolar extraction, but just even with that, he's got a very narrow arch. And so we will be doing myofunctional therapy and hopefully expansion for him too, since his tongue is a little bit too large for his jaw size right now. Derek, thank goodness I started really diving into myofunctional therapy because the orthodontist was talking about removing the same premolar, and I was like, wait, no, this is not what I want to do. Yeah. So he's been doing some exercises. So I've currently got him really enrolled in exercises, especially since he was my first one who was experiencing so many myofunctional disorders.
After his tongue tie release, did he still continue to have an open mouth posture or mouth breathing, or did you notice any of that stopping breathing still, or how did his symptoms continue on as he got older?
Well, oddly enough, and things that I still started put together even after I went to the myo courses and working with you. If you look back at his history, right before we had his tongue released, he had a really severe case of croup. So that's when your airway closes up, and you get that seal-like bark. And his was so severe, we were in intensive care for 4 days and then transferred up to Stanford. And it just took a long time for his airway to reopen again. So that is a huge clue that he has some issues with airway for me. He definitely has a runny nose all the time because he's not breathing through his nose. So he gets very congested, and he doesn't like it when I continue to tell him every day to rinse his nose and make sure he's like, Mom, I see myself on screen all day, every day. My mouth is closed. So yes, he's working on keeping his mouth closed and his nose clear and everything that comes with that.
It's hard with your own family. And I don't know if you saw the interview with Nicole yesterday, but she was saying that she actually had another therapist work with her, I think son or daughter, I can't remember, but she's like, no, I'm not going to do the therapy because it's too hard being mom and therapist. You know, it's a good, I mean, I'm not saying you shouldn't, but I thought that was interesting that she said that.
No, it is true. It is a lot easier to have somebody. So it would probably behoove me to swap. And I think you and I have kind of talked about that, like finding somebody to swap care with.
Like, I'll work with your kids, you work with my kids.
Exactly.
Good idea. Yeah, okay, so that's Derek. And then talk about, and you mentioned your husband. Does your husband snore or have sleep apnea or anything like that?
He does. He snores. I haven't necessarily heard apnea, but he does snore. He used to be a huge teeth grinder, and then of course he's been in a night guard, but we've now been mouth taping at night, and that really helps him a lot.
Do you notice with your husband like an open mouth posture or mouth breathing during daytime? Yeah, okay. So I'm trying to make it so people can see, like, if you have your mouth open, if you mouth breathe, you're way more likely to have all these other things that we're talking about. So the mouth breathing is like the canary in the coal mine of what's going on. You know, it should be a red flag symptom that we're all paying attention to. Hence why the mouth breathing awareness thing. Okay, so that's good to know about your husband. And then you mentioned your daughter and your other son.
Yes, so my other son, Justin, his signs and symptoms aren't as severe. When I do look into his mouth, though, he's got, I would say, like a Kotlow 4. He's got that, if you look, he's got that perfect heart-shaped tongue when he lifts his tongue up, and you can see how tethered that frenum is. So he does have that heart shape. Yeah. He's 13, almost 14.
Okay. All right. So he must be somewhere on the list of like people to have tongue ties next, tongue tie surgery.
Yes, exactly. So he's actually fairly good about keeping his lips closed. He doesn't have those issues. When I do look back as far as being an infant, breastfeeding was hard. Well, breastfeeding was actually very challenging with every single one of them. Yeah. Him in particular, and I knew for sure that if I didn't burp him after each feeding, he was so like you could tell he hurt inside. And he would be crying. So he was getting a lot more air in during those breastfeeding times. So it is really interesting to go back and connect the dots.
Yeah, what you know today, and then you can reflect back to when they were babies, and you can see all the signs. They're all there, right?
So, like I said, he's pretty good at keeping his mouth closed, but he does have some tendencies to open up, especially at
night, I would guess.
At nighttime, and sometimes when eating. He has a really hard time keeping his mouth closed while eating.
Yeah. I'll explain it really quick for people, because if you're tongue tied and you physically can't get your tongue to reach to the top of your mouth, you're very likely to have an open mouth posture and therefore mouth breathing. but a lot of people can compensate well during the day, especially kids, teenagers, and adults, because they're aware of like the social stigma around mouth breathing. So they'll close their mouth during the day, but then often at night when they fall asleep, everything drops open. And so you have all those hours of the night where they're mouth breathing, which is not great, you know, but common.
Mm-hmm. Exactly. Yeah. And then Gigi, she's a bigger case. She has a lot more dysfunctions. So you'll probably appreciate explaining a lot of this. So she's 7, and she grinds her teeth a lot during sleep. She has a really hard time keeping her mouth closed. If we're sitting next to one another, maybe she's reading or doing something, you can hear her breathing through her mouth. Yeah. So it's a very nice shallow. We have not had a sleep study with her just yet. No. It was coming. I do work for an airway dentist now as well, which is super exciting. And we have the high resolution pulse oximeters in our office. So I've had Derek tested and Justin tested, and she was just about to be tested. And then we shut down. Yeah, COVID happened. Yes.
Oh man.
Her teeth are also misaligned. So her jaws are much smaller than they should be right now. So I do have her working with a MyoMentor, which is really helpful.
Awesome. Well, I mean, it sounds like at least you're taking steps, everyone's on the right track, and it takes time. You know, I think it's good for other parents to hear that, like, you know, all these things, and it's still like, it's a process, you know, and it's like, there's a lot to learn. And I mean, we're lucky that we can do the therapy ourselves, but for like regular people, I mean, it gets expensive too. Even for us, I mean, like I've had to pay for orthodontic treatment that's super expensive. And so it, you know, it all adds up. And I think if people can understand the importance, then it's worth it. But since it's not really a mainstream thing to do, you know, airway dentistry, airway orthodontics, myofunctional therapy, tongue tie surgery, it's a lot when you have 4 kids or 4 kids and a husband or 3 kids and a husband who need all this, right?
Definitely.
Yeah. Well, what do you think's next? Like, as far as, you know, just waiting for everything to open back up, what will the next steps be?
Well, some of the next steps are going to be, in my mind right now, releases for both boys. And the dentist I work with, Dr. Ikemia in Monterey, the airway dentist, he has been using Invisalign for expansion.
Cool.
So so that's where our office is headed into doing more Invisalign for expansion, and we've seen a lot of success with that. So Derek, unfortunately, is going to be in braces again. Much easier. He was okay with Invisalign, and Justin as well. He will. I will get him in his Invisalign. So afterwards, just to help guide the growth as well as the myofunction. You know, continuing with myo for sure.
Good. And then I guess a sleep study for your daughter at some point.
Yes, a sleep study for Gigi, and continuing to do exercises with her. And hopefully, you know, with the MyoMentor exercises, it'll be interesting to see how those guide her as well early on.
Yeah. And what about your husband? Well, is he like enthusiastic about this? I know sometimes it's hard to get the dads on board, but
he is. Of course, we are looking to take care of the kids, you know, as parents do. Yes, but he has been super supportive and very excited. Everybody now in my family does talk about mouth breathing, and they notice when people are mouth breathing, and they come to me and they're like,
know.
Oh. Or I have one.
Yeah. I've had my sons where they go to school and they start telling their siblings because they're in myofunctional therapy with me, and they go to school and they tell their friends, like, you're mouth breathing.
Yep, that's what all my kids do. And they mention you should only be breathing through your nose, and people look at them like, what? Why do you know this? And they're like, my mom knows this. She tells me all the time.
That's so cute. Kids are hilarious.
Yeah. So they're going to be
Well,
little myofunctional therapists themselves one day.
oh, totally. What about your own practice? Do you've got like your website and everything set up? If I want to share information with people, do you want to give a little shout out to any of that stuff?
Definitely. Currently, I'm working on my website right now still,
Yeah.
but I do have Breathe by the Bay on Instagram and
Oh,
breatheby.the-bay@gmail.com.
okay. Do you have Facebook?
I don't have Facebook just yet,
Just Instagram? Okay. I'll
just
link that stuff
Instagram.
and then
Yeah,
we can share. And do you want to give any shout outs to any of the doctors in your area you're working with who are helping you out?
definitely. Dr. Ikamia at Monterey Peninsula Dental Office is an airway centered dentist, and
Cool.
it's been really amazing being able to work with him. And he really is a huge advocate for myofunctional therapy.
Really good
And
dentist,
so
right?
exactly, and he's been doing releases as well in the area for us. So it's been wonderful. And then my fellow co-hygienist at the office, Kim Cumming, is also a myofunctional therapist in this area. We've done a lot of
Cool.
courses together.
Oh, that's fun. That's nice to have like a colleague there to like learn and do all this stuff together with. Maybe you guys could trade working with each other. Does she have kids that need treatment?
We definitely have talked about it. Yes, exactly.
That's fun.
Yeah, because both of us, we both talk about how hard it is to do the exercises with our own kids. We're like, we just need to swap.
Yeah, for sure. Oh my
Yes.
gosh. Well, yeah, thank you so much for doing this. I think you're the only one in your family who doesn't have the symptoms, it sounds like you and your one son.
Oh, no, I didn't talk. I didn't talk about mine, but boy, when I went through the intensive course and went through your course, it was very eye-opening to be able to diagnose myself.
Okay, what'd you notice?
Yeah, that I didn't realize that I was a mouth breather, which I couldn't believe
It's so
that I hadn't
embarrassing, but it's
noticed.
so common.
It is embarrassing, and I couldn't believe that it took me until I was 40 to I was a mouth breather. And I have a pretty significant posterior tongue tie. I've got a very
Okay,
narrow
wow.
palate, maxilla, and a very high arch as well. So I put myself through the program,
Good.
and then yes, I was super excited to have my release before COVID, but that didn't happen yet. So
Okay, so
that's
you're in the
next on
works
the
too.
list. Yes, I'm on
Yeah. Oh man. Well, you might as well just have everyone in the whole family do it then.
it's exactly right. Our
Yeah.
family dinners are now myofunctional therapy exercise times.
Yep, exactly. Oh, that's hilarious. Well, I'm so happy that we did this. I'm so happy that you shared your story because families don't realize like if one kid has it, usually everyone else has it. And with tongue ties, they do run in families. So if mom
Yeah,
or dad has a tongue tie, you're very likely to have kids who are tongue tied. And if kids are tongue tied, then you should look at mom and dad, right? So I think
that's correct.
seeing that happens is really important. And you've got like a good showcase of that for us to really understand. So yeah. Anything else you want to say, or should we just wrap it up?
I think that's it for me tonight. Thank you, Sarah. This has been
Oh yeah,
wonderful.
you're welcome. All right. Well, yeah, your story is great for mouth breathing awareness, and we'll just keep spreading information. And I hope lots of people see this video and get to hear your story. So,
Thank you.
all right, you're welcome. Bye.
Have a good evening. Bye.